Good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi Singh and I feel very fortunate that I have gotten this opportunity to present the topic Manage Gastritis Effectively with Radaropus. And I'm very thankful to the BGNRX and BGN publication for giving me this opportunity to present this topic in front of you all. So let's begin with the introduction. Gastritis in an inflammation, irritation, and erosion of the stomach mucosa. It can be acute or chronic. Inflammation of the whole stomach is called pangastritis, and an inflammation of the part of stomach is called enteral gastritis. The incidence of gastritis is highest in the fifth and sixth decades of life. Men are more frequently affected than women. The incidence is greater in clients who are heavy drinkers and smokers. Gastritis is a general term for group of condition with one thing is common, that is inflammation of the lining of the stomach. The inflammation of gastritis is most often the result of infection with the same bacterium that causes most stomach ulcer or the regular use of certain pain relievers. Drinking too much alcohol also can contribute to gastritis. As we already discussed, this gastritis refer to the inflammation of the lining of the stomach. It may last for a few days, that we call acute gastritis, or it may longer for months or years, we call chronic gastritis. It is a clinical finding caused by a variety of disease processes including medication reactions, excessive alcohol intake, and bacterial infection. There are two types of gastritis, erosive and non-erosive. Erosive gastritis can cause the stomach lining to wear away, causing erosion or ulcers. Non-erosive gastritis cause inflammation in the stomach lining but rarely ulcer. Now I'm going to the next slide. That is epidemiology. In acute gastritis, the prevalence of eosinophilic gastritis is approximately 6.3 per 1 lakh individual worldwide. The incidence of new cases of H. pylori infection each year ranges from 3,000 to 10,000 per 1 lakh individuals in developing country. It has been observed that with advancing age, the incidence of H. pylori infection increases. Chronic gastritis is still a relatively common disease in developing countries. The prevalence of H. pylori infection in children in the Western population is approximately 10%. So, I want to tell you more about the epidemiology. In the Western population, there is incidence of declining incidence of infectious gastritis caused by H. pylori with an increasing prevalence of autoimmune gastritis. Basically, autoimmune gastritis is more common in women and older people. The prevalence is estimated to the approximately 2% to 5%. However, the available data do not provide solid information about the incidence and the prevalence of autoimmune gastritis. Okay, now moving to the next slide, that is etiology. Okay, so the etiology is bacterial infection, non-steroid anti-inflammatory drugs, autoimmune diseases, chronic renal failure, bile reflux disease, stress, chronic anxiety, alcohol addiction, cirrhosis, cocaine, radiation and chemotherapy. So the other etiological factors like weakness or injury to the mucus line barrier that protect the stomach walls allows digestive juice to damage and inflame the stomach lining. A number of diseases and conditions can increase the risk of gastritis, including inflammatory conditions such as Crohn's disease. Okay, now moving to the next slide, that is pathophysiology. So the pathophysiology of gastritis is the gastric mucosa is protected from the high acidity of hydrochloric acid in the stomach by mucus secretion. interference with the amount of acid, hypersecretion or echloridia, reduction of mucus production, generalized inflammation results where acute can lead to necrosis, scarring or perforation, decreased production of bicarbonates, increased acid secretion, that is damage to epithelial barrier. Now the type of gastritis. Gastritis can broadly be divided into two types. The first one is acute gastritis and the second one is chronic gastritis. Now I'm discussing about the first one, that is acute gastritis. Acute gastritis is defined as a sudden onset of inflammation of the mucosa. The risk factor includes it usually stem from ingestion of a corrosive, erosive or infectious substance, aspirin and other non-steroidal anti-inflammatory drugs, digitalis, chemotherapeutics drugs, steroids, acute alcoholism, and food poisoning are common causes. Food substances, including excessive amounts of tea, paprika, clove, pepper, can precipitate acute gastritis. Foods with a rough texture or those eaten at an extremely high temperature can also damage the stomach mucosa. Acute gastritis is usually of short duration unless the gastric mucosa has suffered extensive damage. So I want to tell you more about acute gastritis. Acute gastritis refers to a sudden onset of inflammation of the stomach lining, as we discussed in the PPT, called the gastric mucosa. When a gastroenterologist performs an endoscopy, the lining appears reddened and the specimen shows lots of acute inflammatory cells. There may be small shallow break in the surface lining called acute erosion and even tiny areas of bleeding. So acute gastritis may be caused by excessive intake of alcohol, ingestion of irritating drugs, food poisoning, and infectious diseases. The chief symptoms are severe upper abdominal pain, nausea, vomiting, loss of appetite, thirst, and diarrhea. The illness develops suddenly and subsides rapidly. So I'm discussing about the more causes. The acute gastritis is caused by acute irritants that overwhelm the mucous lining that usually protect the stomach mucosa. Irritants include aspirin or other non-steroidal anti-inflammatory drugs. Poisons like including strong alcohol and certain infection, including the early stages of infection with the bacterium Helicobacter pylori. Usually the inflammation settles quickly when the irritant is removed. The other symptoms of acute gastritis can be acute gastritis usually does cause an acute upset stomach with upper abdominal pain or discomfort as the body tries to get rid of the irritants. Other symptoms can include nausea and vomiting, bloating and gas, weight loss, or loss of appetite. So, this was all about the acute gastritis. Now, I'm moving to the next part, that is chronic gastritis, next type. Chronic gastritis is referred to the gastritis that has developed slowly over time. Chronic gastritis occurs in three different forms: superficial gastritis, which causes a reddened, edematous mucosa with small erosions and hemorrhages; atrophic gastritis, which occur in all layers of the stomach, develops frequently in association with gastric ulcer and gastric cancer, and is invariably present in pernicious anemia. It is characterized by a decreased number of parietal and chief cells. The hypertrophic gastritis, which produce a dull nodular mucosa with irregular thickened or nodular rugae, hemorrhages occur frequently. So, chronic gastritis refer to a persistent but low-grade inflammation and damage to the stomach lining. The gastric mucosa become thinner as the normal cells are destroyed. The inflammatory cells include lymphocytes, which indicates an immune response. This is very common, especially in less developed countries, When present for many years, the mucosal changes may progress to a stage called metaplasia with small decreased risk of gastric cancer. So, chronic gastritis can be caused by prolonged use of aspirin or non-steroidal anti-inflammatory drugs, infections with Helicobacter pylori, or pernicious anemia. The symptoms are indefinite and often resemble those to functional digestive disorders. The symptoms may include discomfort, fullness, or pain in upper abdomen or poor appetite. Casein. So, I want to discuss about the more causes of chronic gastritis. Chronic gastritis usually result from infection with Helicobacter pylori. In the United States, H. pylori infection is present in about 20% of Caucasians, but in over 50% of Hispanics, African American, and the elderly. The infectious rate of adults in underdeveloped countries may be as high as 90%. The other causes of chronic gastritis may include an autoimmune disease, specific rare infection, that is we call HIV and AIDS, Crohn's disease, gastric surgeries, which increase the stomach exposure to bile. The symptoms can be like, in the vast majority of cases, a chronic gastritis causes no symptoms. When the damage to the mucosa is severe and long standing, the stomach loses its ability to produce acid. This may cause digestive upset and also lost in the ability to secrete a substance called intrinsic factor, which is necessary for absorption of the vitamin B12. Deficiency of vitamin B12 eventually lead to a condition called pernicious anemia. Patient present with tiredness, anemia, symptom in limbs such as numbness or tingling, but it may be rarely. Now I'm moving to the next slide. This is all about the types. Now, in chronic gastritis, the etiologic factors like peptic ulcer disease, infection with Helicobacter pylori bacteria, or gastric surgery may lead to chronic gastritis. After gastric resection with a gastrogystomy, bile and bile acid may reflux into the remaining stomach and causing gastritis. H. pylori infection can lead to chronic atrophic gastritis. Age is also a risk factor. Chronic gastritis is more common in older adults. Now, the sign and symptoms. Many people with gastritis don't have symptoms. People do have symptoms, often mistaken them for indigestion, and the symptoms are like abdominal pain and burning, often in the upper center of the abdomen called the gastric area, epigastric area, bloating, weight loss, belching, indigestion, anorexia, nausea and vomiting, hiccups. Anorexia is a loss of appetite. So the other symptoms are like black and terry stool, feeling extra full during or after a meal, stomach ulcer, losing weight without meaning to, upper abdominal pain or discomfort, and bloody vomiting. The severe gastritis lead to life-threatening symptoms include severe chest pain, feeling faint or short of breath, severe abdominal pain, sudden onset of bloody stool. Blood may be red, black, or terry in texture, vomiting blood or black material, resembling coffee. So this was all about the symptoms, sign and symptoms of the gastritis. Now moving to the next slide, that is a risk factor of gastritis. Factors that increase your risk of gastritis include bacterial infection. While Helicobacter pylori is one of the commonest infection, it doesn't always lead to gastritis. It is believed that the risk of this infection is often multiplied by poor lifestyle choices, including an unhealthy diet, smoking, or alcohol intake. The second one is regular use of pain reliever. So I want to tell you this: regular use of a group of pain reliever called non-steroidal anti-inflammatory drugs like ibuprofen, naproxen sodium, etc., can lead to both acute and chronic gastritis by damaging the mucosa. The third one is older age. Advancing age, since the stomach lining tend to become progressively thinner with age, elderly individuals are more prone to H. pylori infection or autoimmune disorders. The fourth one is excessive alcohol intake. Excessive drinking, since alcohol irritates or erodes the stomach lining, binge drinking can cause acute gastritis. The next factor is stress. Stress, many major surgical procedure, injury, burn, or infection can cause severe stress leading to acute gastritis. The next one is your own body attacking cell in your stomach and other diseases and condition. At the last, I'm going to tell you one more factor, that is autoimmune gastritis. When your own immune system malfunction and attack the cell of the stomach lining, it can lead to gastritis. People with autoimmune disorder, including type 1 diabetes mellitus, are more prone to this form of gastritis, which has also been linked to vitamin B12 deficiency. And after risk factor, I want to discuss little about the prevention. What are the prevention of gastritis? There are some things you can do. Maintaining good hygiene habits like hand washing may help you reduce trusted source and the risk of having H. pylori infection. Taking good care of your mental health, self care, and de-stressing practice may reduce your risk factor of developing trusted source stress induced gastritis. Eating smaller meals or more slowly or regularly, quitting smoking if you smoke, avoiding or limiting alcohol and caffeine. So this was all about the prevalence or the prevention actually. Now at the last, I'm going to tell you about the management, how you can manage with gastritis. Avoid spicy and fatty food, avoid regular use of painkiller drugs, avoid eating late nights or close to bedtime. You must finish eating at least 3 hours before sleeping. Quit smoking and avoid too much alcohol. Smoking increases the inflammation of gastric mucosa and increases the risk of ulcer. Eat fiber-rich food to improve digestion. Get plenty of exercise, at least 30 minutes per day. Drink green tea and replace milk, coffee, and tea by green tea. I want to discuss about some more managements strategies like stay emotionally healthy, drink enough water, reduce stress, which help in reducing symptom of gastritis. Avoid spicy food, avoid coffee, avoid milk, tomatoes. Tomato is acidic in nature, can irritate stomach mucosa. Citrus fruits and juices like lemon or oranges worsen symptoms, so avoid them. Avoid processed food. Basically processed food like bread, pastas, fried foods increase the inflammation of the guts and slow down the healing of gastritis. So at the last, I'm going to tell you about the complication part. So there are some complication if gastritis left untreated. The gastritis can lead to serious problems such as anemia. H. pylori can cause gastritis or stomach ulcer that bleeds, thereby lowering your red blood count, that is RBC. Pernicious anemia, autoimmune gastritis can affect how your body absorbs vitamin B12. You are at risk of pernicious anemia when you don't get enough B12 vitamin to make healthy red blood cells. Stomach cancer, gastritis caused by H. pylori or autoimmune disease can cause growths in the stomach lining. These growths risk your stomach cancer. The last one is peritonitis gastritis, can worsen stomach ulcer that break through the stomach wall can split stomach content into abdomen. This rupture can spread bacteria, causing a dangerous infection called bacterial translocation or peritonitis. So this was all about gastritis from my part. Now I'm going to discuss a case with you all. Now I'm going to present a live case of my patient. A female patient of age 36 years reported at my clinic with the complaints of retrosternal burning, frequent sore eructation, belching, flatulence, gases, and reflux of food, heaviness in throat and chest. Since the last 2 years, there were frequent episodes of dysphagia with choking sensation in throat while eating. She had a history of constipation with hard stool, and complaints would increase at night after meals by eating chilies and in the evening. She would take antacids as and when required. She had been suffering from gastritis since 2 years, so she complained by burning in the throat, water breath. She was very anxious as to what will happen to her life if she get hospitalized. At time, she used to become sad and wept while thinking about her future. So this was all about my presentation of my patient when he came to my clinic. So the history of present illness: patient was approximately healthy 2 years back. Then she started complaining of mild abdominal discomfort with abdominal pain. Then gradually realized like nausea, vomiting, icterus, fever, burning in the throat, water brush, sore eructation, pain in epigastric or hypochondric region, which was aggravated by touch, aggravation after eating and drinking warm liquids, and generalized weakness, aversion to milk. The past history of my patient is: there is a strong history of recurrent sore throat, infections with fever, and diffuse myalgia. Lately, any slight error in the diet lead to sore throat and fever. In the past, she had suffered from typhoid in October 2013. There is also a history of recurrent urinary tract infection, that is UTI, from January to July 2014, and also recurrent episode of viral fever with throat infection. In the family history, his dad has GERD, that is gastroesophageal reflux disease. His mother also has complaint of acidity. Now the mental journals of my patient are like: she has an unexplainable fear of heights, high places, that will never look down from the window of the skyscraper. Fastidious in nature, irritable with family members, though does not express his anger easily. Anxiety about her condition or health, becomes angry on seeing mess in the room, wants everything neat and clean. Now, the next part is physical journals. Her thermal reaction is ambithermal patient, anxiety reduced, and declination to eat generally, taste spicy food, digestion weak, feels full on eating small amount, thirst are like decreased, only two glasses in a day, urine normal micturition, stool hard and constipated stool, sleep normals, dreams not specific. Now, at the last, I'm going to discuss about the gynecological history of my patient, the menarche at the age of 14 years, cycle and duration of menstrual blood like 5 days, flow was normal. Licoria, having the problem of licoria since 1.5 year, with creamy white thick moderate discharge, having offensive smell with generalized weakness. On physical examination, her BP was 110 by 60 mm of Hg, pulse rate was 74 per minute, regular. Pallor was evident from face and conjunctiva. Her weight was 50 kg and height was 155 centimeter. No further abnormalities were detected on a brief examination. Thank you so much for staying with us. We will be starting the presentation and training. How can we repertorize this case with the help of Radaropus? I will be sharing my screen to you all. So this is Dr. Shivangi Singh, and I will be demonstrating you all how you can get started with Radaropus and how can we repertorize a case. Before I start, let me explain to our viewers how this interface work. On the right hand side panel of your screen, you have a short chat box. You may type your questions or whatever message you have right there. Press button next to it and send it to us. Okay, now I'm going to start my presentation. I'm going to share my screen with you, then you'll be able to see the software on your own screen. So whenever you open your Radaropus software, you will be able to see your screen in this way. Synthesis Adonis repertoire is by default open. The above icons are called icon bar or toolbar. These icons, which are present in the left hand side of your screen, are known as primary icons, consist of repertories, references, patient management, remedies, and families. So today I'm going to repertorize my case with the help of Synthesis Adonis repertory. But first of all, I'm going to tell you how you can open your repertory. So first of all, I'm going to the repertories icon. After clicking on this icon, you will get all the list of repertories. Radar comes with more than 20 repertories, including synthesis. So whatever repertory you want to open, you can scroll with the help of this scroll bar, else you can type the name of that repertory in the search bar and you can get your repertory. So today I'm going to repertorize my case with the help of Synthesis Adonis. Synthesis Adonis repertory is a successor version of Synthesis Treasure Edition. So for doing the repertorization, I will be needing few icons. The first icon is this binocular find rubric. If you click on this icon, you will get this navigation window on your screen. It contains all the chapters that belongs to this particular repertory. So the first rubric of my patient is having the fear of high places. So fear is a mental symptom. I'm going to the mind chapter. If you click on this chapter, you'll get all the rubrics that comes to this chapter. You can scroll them, else you can type your symptom here. Start typing the first letter of the rubric you wish to see. Okay, now I'm typing here. My patient is having the fear high places of. Now my rubric have opened on my main display screen from mind chapter. Fear is my rubric, high places of my sub rubric. Now we have multiple clipboards here. They're just like our repertorial sheet. For doing a repertorization, you can add your rubric into this clipboard and it will automatically get repertorized. So for taking any rubric into the clipboard, we have three methods. The first one is dragging and dropping. With the help of your cursor, you can drag it and drop it. Now the next symptom of my patient is having anxiety for others. She is very anxious, having anxiety. So anxiety is also a mental symptom. Again, I'm going to the mind chapter. Mind, anxiety, others of. Now my rubric have opened on my main display screen from mind chapter. Anxiety is my rubric. Others of my sub rubric. Now I'm going to add the second rubric into my clipboard with the help of my second method. And my second method is the plus button on your keyboard. The plus button of a keyboard is the second method. As soon as I clicked on my plus button, my rubric is added to the clipboard. You can see here. My patient is having the delusion of getting sick all the time. So delusion is also a mental symptom. Again, I'm going to the mind chapter. Mind, delusions, sick, being. Being is already here. So I click on it. Now my rubric have opened on my main display screen. Now I'm going to add this third rubric into my clipboard with the help of third method. And my third method is this icon. Take the current rubric icon next to this binocular. As soon as you click on this, your rubric is added to the clipboard. Okay, so the next symptom, my patient is having unquenchable thirst. So for thirst, I'm going to the stomach chapter. Stomach, thirst, unquenchable. unquenchable. Now my rubric have opened on my main display screen from the stomach chapter. Thirst is my rubric, unquenchable is my sub rubric. Now I'm going to add this rubric into my clipboard with the help of my first method. As I told you, my first method is dragging and dropping. You can drag it and drop it. Next symptom of my patient is having the heaviness in epigastrium, having the heaviness in epigastric region. So I'm going to the stomach chapter again. Heaviness, epigastrium. Now my rubric have opened on my main display screen from stomach chapter. Heaviness is my rubric. Epigastrium is my sub rubric. Now I'm going to add this rubric into the clipboard with the help of my second method. As I told you, my second method is plus button on my keyboard. Now you can see here my rubric is added to the clipboard. As soon as I press my plus button. Next symptom, my patient is having a heaviness after eating. Whenever he eats their meal, he feels heaviness. So again, I'm going to the stomach chapter, stomach, heaviness, eating after, eating after, aggravation. So my rubric have opened on my main display screen from stomach chapter. Heaviness is my rubric, eating after aggravation are my sub rubric. Now I'm going to add this sixth rubric into my clipboard with the help of my third method, and my third method is this icon. Take the current rubric icon. As soon as you pressed on this icon, your rubric is added to the clipboard. The next symptom of my patient is having the desire for spicy food. He always desired to eat spicy foods. So I'm going to the genetics chapter for this. In genetics chapter, you'll get food and drinks chapter, sorry. Food and drinks, spices, spices, desire. Now my rubric have opened on my main display screen. So from genetics chapter, food and drink is my rubric and spices desire are my sub rubric. Now I'm going to add this rubric with the help of my first method, that is dragging and dropping. The next symptom of my patient is having aggravation from tea. Whenever she takes tea, she feels like heaviness in her stomach. So this is the next symptom. I'm going to the genetics chapter, food and drink chapter. Tea aggravation. My rubric have opened on my main display screen. I'm going to add this rubric to my clipboard into my clipboard with the help of my second method. And my second method, as I told you, my second method is a plus button on your keyboard. As soon as you pressed your plus button, your rubric is added to the clipboard. The next symptom of my patient is having the problem of offensive licoria. So I'm going to the female genitalia 6 chapter. I'm going to type here licoria, offensive. Now my sub-rubric is offensive. Now my rubric have opened on my main display screen from female genitalia sex chapter. Licoria is my rubric, offensive is my sub-rubric. Now I'm going to add this rubric into my clipboard with the help of my third method, and my third method is this icon next to this binocular. Now my rubric has been added to my clipboard. The next symptom I'm going to take, my patient is having one more thing I'm going to tell you, I'm going to discuss is my patient is having aversion from milk. So I'm going to find this rubric with the help of this genetics chapter, food and drink chapter. You can write down your symptom here, milk aversion. My patient is having aversion from milk. Now my rubric I have opened on my main display screen from Genetics chapter, food and drinks, milk aversion. Now I'm going to add this rubric into my clipboard with the help of first method, that is dragging and dropping. You can drag it and drop it. The next symptom of my patient is having the problem of constipation with difficult or with hard stool basically. So I'm going to the stool chapter, stool hard. My rubric have opened on my main display screen from stool chapter. Hard is my rubric. Now I'm going to add this rubric into my clipboard with the help of my first method, that is dragging and dropping. I have taken all the rubrics into my clipboard. Now I'm going to my repertorization. So I simply click on my keyboard, on my clipboard. You will get your repertorization, you will get your rubrics, sub rubrics, you'll get your chapters, rubrics, sub rubrics, you'll get your remedies, you'll get your gradings. We have taken total 11 rubrics here, and Nux Vomica cover all the 11 rubrics, and the total is 23. If you add these numbers like 1 plus 2 plus 3, 1 2 plus 3, the total will be 23. Arsenic cover all these 11 rubrics that have taken here, and arsenic cover 18 rubrics. Sorry, the total will be 18. If you add these number, the total will be 18. Sulfur covers 9 rubrics out of 11 and the total is 21. In the same manner, you'll get your gradings, you'll get your probable remedy list. If you want to read any remedy from your probable remedy list, you can open it by double click. Just simple double click on your remedy and your remedy will open on your main display screen. In this way, you will get the multimedia image of their plant also. Now I'm going back to my analysis. In this tab, my analysis remains open. The one more thing I want to discuss, our software is all-in-one interface. Whatever icon you open will remains open in different tabs. You can move them quickly from one tab to another. Now I'm going back to my analysis. Now my analysis have opened on my main display screen. Suppose you want to read sulfur, so just double click on your sulfur will open on your main display screen in this way. Now I'm going back to my analysis. So no need to go to this remedies or references icon for reading your remedies. Just simply double click on your remedies and your remedies will open on your main display screen. So this was all about repertorization, how you can find your rubrics with the help of Radaropus, how you can find your rubrics with the help of synthesis Adonis. In synthesis Adonis, you can find your rubrics in a layman language. You just write down your symptoms, you will get the rubrics. Okay, so I'm going to my slide, I'm going to my prescription part. So this was all about gastritis and how we can repertorize the case with the help of synthesis Adonis and Radaropus software. Now I'm going to discuss about the prescription part. The medicine I have prescribed, Nux Vomica 200 in 3 doses in 8 hourly, followed by placebo 30, 4 pills TDS into 7 days, was prescribed on first visit considering the repertorial totality. The journal management I have given to my patient is advised to modify her diet regimens, drink plenty of water, avoidance of late night dinners, spicy and fried food, consuming lot of greens, vegetable and fruits, walking after dinner, avoid immediately lying down after eating. So this was all about my first prescription. In the next follow up, in the second follow up, the body ache and tiredness, retrosternal heaviness much better, and heartburns once a day. No burning whole week, but anxiety is still there. Anxiety is still less, appetite is still less. I have prescribed Nux Vomica 200 single dose state orally, followed by placebo 4 pills BD for 10 days. And the journal management I have given to my patient along with medicine. Counseling was also done to calm the mental irritability and other complaints. Lifestyle changes like avoiding spicy food, fatty food, alcohol, and tobacco. In the third follow up, the much relief in burning, frequent sore, irritation, belching, frequent flatulence, gases, and retrosternal heaviness much better, and heartburn relief. This condition had improved by 80%. His gastric symptoms or anxiety both were showing good result. So I prescribed placebo 30 BD for 10 days. So this was all about my case, how you can repertorize your case. All right, now I would like to request all the viewers to comment in the chat box with their questions now. We will begin the question answer session. So a learner wants to know, is gastritis lifelong? Basically, gastritis tend to be lifelong and spontaneous, healing and rare. With very few expectation, gastritis is associated with the presence of a bacterium Helicobacter pylori. Now I'm going to take the next question from a viewer side is gastritis contagious? So I want to tell you this: gastritis isn't contagious, but the bacteria, that is H. pylori, can be contagious via the fecal to oral route. Good hand washing before handling of foods and proper sanitization are the first line of defense against the spread. Many people can develop gastritis after being infected with H. pylori bacteria. So the another question from a viewer side is, what should you eat if you have acute gastritis? So basically, individual with acute gastritis may be advised to make certain dietary changes, such as eating a bland diet consisting of soups, vegetable, lean meats, fish, and non-carbonated drinks. Other recommendation includes avoiding irritating foods like spicy or fatty food, eating more frequent and smaller meal, reducing the intake of alcohol and caffeine. I think we have almost taken up all the questions. So let's take the last question from the viewer side is, what causes gastritis? This question is really interesting. Common cause of gastritis including drinking alcohol and other harsh substances that hurt your stomach lining. Infection most commonly with bacteria like called Helicobacter pylori. Stress including stress from the serious injury or illness. Medicines that irritate your stomach including certain pain medicines, that is non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen. So let's wind up here. Thank you, everyone. I would like to thank all the viewers, the homeopathic fraternity who have joined us here today. Thank you. Thank you so much. Have a great day. Keep learning, keep improving.